Robby, what's on your radar?
There was big news late last week. The Supreme Court blocked President Biden's vaccine mandate for private workers from going into effect. The vote was 6-3 with all the conservative-leaning justices, that's Roberts, Alito, Kavanaugh, Thomas, Gorsuch, and Barrett, voting to halt the mandate, and the liberals, Breyer, Sotomayor, and Kagan, voting to let it go into effect. Separately, the court allowed the federal government's vaccine mandate for healthcare workers to take effect. This is a much narrower mandate that only applies to Medicare and Medicaid-funded hospitals and medical facilities. This decision was 5-4 with Chief Justice Roberts and Justice Kavanaugh siding with the liberals that the federal government, specifically the Department of Health and Human Services, did have the power to require vaccination of medical staff because it protects the health of patients. But Biden's far-reaching OSHA-enforced requirement that 84 million private sector employees either get vaccinated or get tested constantly on their own dime, well, that mandate is halted, and in the majority decision, the justices gave every indication they intend to strike it down entirely. Applicants are likely to succeed on the merits of their claim that the secretary lacked authority to impose the mandate, wrote Kavanaugh in the majority decision. Administrative agencies are creatures of statute. They accordingly possess only the authority that Congress has provided. The Secretary has ordered 84 million Americans to either obtain a COVID-19 vaccine or undergo weekly medical testing at their own expense. This is no everyday exercise of federal power. Kavanaugh goes on to note the law gives OSHA its power, does not permit the agency to prescribe broad public health measures, just health measures that specifically relate to the workplace. COVID-19 is not specifically a workplace hazard. There are all sorts of environments outside the workplace where one could encounter COVID-19, and vaccination isn't some temporary workplace safety measure. Construction workers, for instance, can remove their hard hats when they head home, but they obviously wouldn't be able to unvaccinate themselves. Vaccine status isn't something you can just turn off. You're either unvaccinated or you're vaccinated forever. It is telling that OSHA, in its half-century of existence, has never before adopted a broad public health regulation of this kind, wrote Kavanaugh, addressing a threat that is untethered in any causal sense from the workplace. In his concurring opinion, Justice Gorsuch wrote that this court is not a public health authority, but it is charged with resolving disputes about which authorities possess the power to make the laws that govern us under the Constitution and the laws of the land. According to Gorsuch, it is clearly the Congress and the states that possess the power to impose broad public health mandates like vaccination. Neither Biden nor OSHA can simply declare it. Legislatures have to act. Democrats want a vaccine mandate, then Democratic legislators have to propose legislation that includes one. They can't just pretend that the power to impose it already exists under previous laws that were clearly never intended to be read that way. As my colleague at Reason Magazine, Jacob Sullum, explained in his article about the decision, liberals disagreed. They did not see COVID-19 as especially different from other workplace hazards. COVID is, to quote the dissent, an infectious disease that has already killed hundreds of thousands and sickened millions, that is most easily transmitted in the shared indoor spaces that are the hallmark of American working life. It is perverse, given these circumstances, to read the Act's grant of emergency powers in the way the majority does, as constraining OSHA from addressing one of the gravest workplace hazards in the agency's history. But of course, OSHA can address COVID-19 in the workplace. It just needs new and explicit orders from Congress to do so. If Democrats want to force these kinds of measures on people, they need to run for Congress on an explicit platform of forcible vaccination. They need to win office, and then they need to pass legislation. That's how the system is supposed to work. Now, of course, in practice, they can't do that because there isn't enough popular support for a nationwide vaccine mandate. According to Economist YouGov polling, Biden's vaccine mandate barely cleared 50% overall. And that was back in the fall when it was more apparent that perhaps widespread vaccination could hold back cases. Today, as Americans contend with the Omicron wave, which has seen thousands and thousands of vaccinated people catch COVID-19 anyway, there's much less justification for forcing someone to get vaccinated in order to protect other people in their workplace. Those people can obviously contract COVID anyway. The vaccine is about protecting the health of the person who gets the vaccine. By reducing the odds, that person will visit the hospital or die. You protect yourself from COVID by getting vaccinated, not by forcing this choice on someone else. The Biden administration is clearly frustrated that they have had no better luck controlling COVID cases than the Trump administration. It is now increasingly resorting to desperate plans. Feeling sick, possibly with COVID? Well, now you can order a test from the federal government, and the Postal Service will ship it to you in just 7 to 12 days. As even the New York Times concedes, that is likely to be after the Omicron peak has already passed, obviously likely to be after someone is possibly recovered from the symptoms that caused them to seek the test in the first place. So the government should realize that it can't test its way out of the pandemic. It can't mandate its way out of the pandemic. It can't mask or lock down or socially distance its way out of the pandemic. Government leaders can and should encourage vaccination and booster shots as an individual health measure. Your vaccine protects you from severe hospitalization and death. If you're vaccinated, your eventual experience with COVID, because, spoiler, you can and will get it at some point, will be mild. Overwhelmingly likely to be mild. It truly will be just the flu. That's kind of the best we can do, and we need to admit it. So I think we were not surprised to see the vaccine mandate halted and likely to be struck down entirely. I saw a lot of fury from liberals, Democrats, et cetera, on Twitter, but I mean, I agree with the decision, and I see how maybe you disagree with the decision, but it's not a crazy decision. They're just saying that, look, the law that governs OSHA did not intend for this eventuality. We're not saying under no circumstances could you do a vaccine mandate. We're just saying the agency doesn't clearly have the authority to do that. Legislature would need to give it more authority. Yeah,
you could see how it could be a stretch to shoehorn the policy in through OSHA.
Right.
Which was clearly what they were doing. On the other hand, workplaces are indeed a significant source of spread because that's where people are together. Basically you have two major sources of spread, one being in the home and two being at work. Obviously you can't prevent people from being at home. So what was the first thing that was done to address the pandemic in the beginning? They shut down as many workplaces as they possibly could, and it did slow the spread. In fact, when epidemiologists talk about the way that a virus evolves and creates new variants that are more transmissible but weaker, one of the reasons for that is that animals and humans, it's not just that they die much faster if a virus is much stronger, and therefore a virus doesn't want to evolve to be too strong, because if it kills all its hosts, it's also, if it makes you super sick, then you stay home.
You don't spread it.
So we have known for millennia that social distancing does work to some degree, but that's the question on the degrees. It's interesting to think what would have happened if Obama had replaced RBG and replaced Scalia.
Yeah.
Then it's 5-4.
Yeah.
For OSHA. And so I think we're going to see a lot of 6-3s for a very long time.
Yeah.
That would have been 5-4 had RBG made a different decision and if Democrats hadn't lost the Senate in 2014. We'll be living with that for decades.
It could be 7-2. Breyer it looks like is not inclined to take his moment to retire. The moment is now. Right. The window is getting very, very small for him to retire and be replaced by someone who shares his judicial philosophy.
Yeah.
In fact, that window is going to be gone.
Got less than a year.
It's got less than a year. And I think it's not expected that he is going to retire, but I don't know. Yeah. They're got to really strong arm him if they
he just wants to keep writing minority opinions until he dies.
Yeah. An ever shrinking minority. But it's and again, I think the case for going back to the mandate, I think the case for forcible vaccine has gotten worse because it's just, I know it is, you're less likely to spread it. But you can still, if it was truly the case that you're vaccinated so you can't spread it to anyone else, then you see how someone could construct an argument that we need to force vaccination in the workplace to protect you or to protect the vulnerable or whatever. But now it's just spreading regardless.
Right.
So
the robust number of breakthroughs certainly makes it harder to make the case. But I think it would have failed no matter what.
Yeah.
Because of the lean of the court here. And the country's, I think, just going to continue to be increasingly ungovernable.
And Congress is broken, so you can't pass legislation anyway because Congress is broken. But that's not the Supreme Court's fault that Congress is broken.
Supreme Court and Citizens United get a significant piece of the blame for Congress being broken there.
Well, we would need more time to discuss that.
Next time.
Okay. I'm looking forward to what's on your radar coming up next.
Got it.